Running a practice can be scary. Thanks to Therapy Note's streamlined platform and legendary customer support, it doesn't have to be. Combining billing, scheduling, telehealth, e-prescribe, and more into one easy-to-use platform, it's no wonder they're the number one choice for mental health professionals everywhere. Try it for 2 months free today using promo code MODERN. This episode is also brought to you by Buying Time. Since 2007, Buying Time has supported entrepreneurs and therapists on their admin, marketing, and bookkeeping needs, and so much more.
Check out their free Buying Time Systems Inventory Checklist to uncover hidden expenses and optimize spending in your practice at buyingtimellc.com/MTSG.
You're listening to the Modern Therapist Survival Guide, where therapists live, breathe, and practice as human beings. To support you as a whole person and a therapist, here are your hosts, Curt Widhelm and Katie Vernoy.
Welcome back, Modern Therapists. This is the Modern Therapist Survival Guide. I'm Curt Widhelm with Katie Vernoy, and this is the podcast for therapists about the things that go on in our practice, the emerging trends in the mental health field and space. And one of the parts of my practice that I've worked with throughout my career has been working with neurodivergent folks. I got my start working with a lot of autistic clients and their families. That has expanded into a lot of ADHD-ness over the years. One of the questions that I get a lot from adults later in life is just kind of, my kid has these things. I'm starting to see a lot of things emerge in myself, and is it possible that I just went throughout my life without being diagnosed by this stuff? And then we send people to people like our guest today, Dr. Monica Blied. Thank you very much for joining us today and sharing your expertise.
Thank you so much for having me. I'm glad to be here.
I'm super excited because, as I told you before we got started, I crashed your talk at a conference, and I just love the knowledge that you have, the way that you talk about things. And as someone who is exploring my own self-diagnosis as a later in life neurodivergent folk, I'm just going to soak all this up. But before we jump into it, I want to ask the question that we ask everyone that comes onto the podcast. Who are you, and what are you putting out into the world?
Yeah, who I am, I'm still trying to figure that out. Knocking on 40's door, still trying to figure that out. But I think I carry many roles and responsibilities, including being a mother of 3 neurodivergent children, being the wife of a neurodivergent husband. And I did know before we got married about him, I didn't know about myself. And that's how well we clicked. It came, we're 7 years in, and I'm like, oh, all makes sense. I'm also a clinical psychologist in Southern California. I run a private practice, Faces of Health, in Claremont, where I provide autism ADHD assessments and therapy for chronically ill folks. Why chronically ill folks? I'm chronically ill myself. And so that's one of my multiple identities and my responsibilities to help give back to the lupus community specifically.
One of the questions that we ask at the beginning of a lot of our episodes is not from a shaming place, but a place from, as we learn new things in the field, as we've learned from our own mistakes, to help other people not make those same mistakes. But what is it that therapists tend to get wrong about later diagnosis, ADHD, autism, that kind of stuff?
I think that when it comes to late diagnosis of ADHD and autism, it's not the therapists who are getting things wrong, but the other providers. So they're the psychiatrists and the physicians and the people who surround a person who's in therapy saying, like, there's no way that you could be autistic. Like, we just had a conversation. Or there's no way you could be ADHD. I actually had a client of mine come back to me who's a psychiatrist said this to her, like, you weren't diagnosed at 5 years old. So there's no way that you can have it. And it's actually the therapists that I'm finding that are most savvy and keeping up with continuing education units and those sorts of things to know, like, not only is late diagnosis possible, but it's actually quite common. Something that some individuals may not be aware of is that up until 2013, a provider could not diagnose both ADHD and autism, even though there's a really high co-occurrence rate between them, and also an overlap of genetic factors between ADHD and autism. And so when I talk about them, I usually talk about them together because so many folks who are autistic are also ADHD and vice versa. And we call this population ADHD, like AUDHD. And so that was kind of like a way around your question, saying like, I think the therapists are actually getting it right. And so they're referring their clients to, get formal diagnosis or just affirming their self-identification, their self-diagnosis.
Why do you think there's been such a surge in late diagnosis lately? Because it seems like, and part of it's what's being served to me on Instagram and TikTok and all the things, but it seems like everyone is now ADHD and autistic, and there's so much stuff that is coming to light. It just seems like this is, something that is very, very different than what maybe was going on 3-5 years ago.
You said the answer in your question, that there is the TikTok and the other social media outlets where people who are already diagnosed or self-identified again are saying like, hey, these are my experiences. And then others are watching that like, oh, wait, that's not typical. Like other people don't do that. Like only autistic adults, or individuals assigned female at birth do those, behaviors, or in the same thing with ADHD. So people are really resonating with the lived experiences, especially of ADHD, autistic, and ADHD therapists who are experts in mental health and saying like, hey, this is my life. And this is what, the features of these different conditions look like. And when you get that information, it's so empowering. I think 10 years ago, even, well, first, TikTok wasn't really popping back then, Instagram and, so on and so forth. But in addition to that, there was this kind of way of doing therapy where, and it's still present in some orientations where it's like a blank slate and you don't share anything about you. But the more we've had people to actually share their experiences, no, I'm not a blank slate. Like I said in the introduction to this podcast, I'm a person who's chronically ill, ADHD, a mama, like, all these things. I'm going to bring my whole person into the therapy room. And that does mean that there will be some people who are turned off by that and not seek me out. And yay, that means I have less of a miserable experience being your psychologist, right? Because the people who do find me and we do connect, it's going to be a really good fit. So I think that's number one, experts who are coming out and saying like, this is my lived experience. Also, we have individuals, because there is such a high co-occurrence rate in families with these conditions, that their kids are being diagnosed. And so they're like, wait, I had these experiences as a child too. Or their other family members. There are just so many reasons. But it's definitely not like everyone has it and, those sorts of things. It's still a small segment of the population overall. But it depends on who you're talking to, who you surround yourself with, because I'm all about neurodivergent people around me.
In one of our previous podcast episodes, we were joined by one of the co-authors of the DSM-5 and the DSM-5 TR, and they had made a kind of controversial statement in that episode that was like, there needs to be a line in the diagnosis somewhere where not just I don't remember the exact quote off the top of my head, but not everybody who's just weird ends up needing to have a neurodivergent diagnosis. And there was plenty of online feedback calling out this guest. Mm-hmm. So I'm wondering your stance on where you have conversations with people as far as like, okay, this is some lived experience stuff. This is what neurodivergence is versus all right, maybe you just got some idiosyncratic things yourself, but that's not necessarily neurodivergent. When you're talking with people as part of an identity, how do you communicate this with them as far as like, okay, you might have learned some things along the way that make this a subclinical diagnosis. How do those conversations go?
The purpose of the DSM, and not everyone believes in it, but as a licensed and trained psychologist, I do. It's kind of like our guidebook for, not kind of like, it is our guidebook for diagnosis and treatment. It's there for a reason. And so if someone meets 5 out of 9 criteria for major depressive disorder, for example, then they're not just a little sad or, a little weird with their happiness. They are clinically depressed. They have major depressive disorder. And similarly, if someone meets the diagnostic criteria for ADHD, they're ADHD. Same thing for autism. And so that's what the DSM is there for. And as a therapist, and I imagine that a lot of therapists are listening to this, if you're looking at the DSM criteria on one hand and you're listening to the experiences of your client on the other, I think that's a good justification for them to start exploring formal diagnosis. Formal diagnosis can sometimes happen, just in that therapy room, or if that person actually needs accommodations for work because they're being harassed or discriminated against, or things are changing too fast as far as teams or training, or for school, or just for their own self-satisfaction and to feel like there is an explanation for their experiences and a path forward as far as specific treatments, they might seek a formal assessment. And so I qualified that with, it's not always necessary, but in those cases, it can be really helpful.
I think the big question is when someone is self-diagnosed, they're identifying with lived experience, and based on our guest, they don't meet the criteria in the DSM. There feels like there's a gap there of what therapists can do really for folks who don't meet the criteria, but claim the diagnosis or claim the identity. And so I if you have thoughts on that, I'd love to dig into that part further.
Yeah, I would love for the therapist to dig into why. What does this mean to you? Because I have had people who've come to me for diagnosis and that's not what it is. They're not neurodivergent, but they have, maybe rejection sensitivity plus, a mood disorder or something else that's going on. And often what's the case is they have a friend group, or some sort of group community where they fit in and things finally make sense. And so as a therapist, you can ask, why? What would this mean to you if you were? And what would this mean for you if you're not actually neurodivergent? And so if they're not actually neurodivergent, it could mean there's more, shame about their behaviors or their experiences. It could mean that now there's nowhere that they really fit in the world. It could mean so many things. And so kind of exploring that further and validating their wantingness to have an identity that maps on to their experiences, but then also educating that like, hey, these are neurodevelopmental disorders, which means these are things that you're born with. And they show up in early childhood, even if they're masked by other things or you have compensatory behaviors. And there are a lot of things that look like ADHD, for example, that are not. So many things, which is why ADHD in particular is important to get a formal diagnosis. So trauma and major stress and sleep apnea, which not a lot of people, are aware of, and symptoms of major depressive disorder, symptoms of generalized anxiety disorder, and so many other things. The person could have severe social anxiety that does not actually map onto them being autistic because they don't have the repetitive behaviors or restricted interest. Or it could be that the person again, needs a formal evaluation because their repetitive behaviors are internalized. They're not necessarily like, tapping a pen over and over or, stripping pieces of paper, but they're having these ruminative thoughts about every social interaction that keeps going on, or they're counting up to a certain number and they don't meet diagnosis for OCD, for example. And so that is a very long-winded way to say that it depends. But just supporting and exploring further with that client, I would recommend.
Not only does Therapy Notes combine the basic tools you need to succeed in your practice, but they also offer an ever-growing library of outcome measures, custom forms, secure messaging, and more. And with their always available live customer support 24 hours a day, 7 days a week, help is just a phone call or email away. Try it for 2 free months today using promo code MODERN. How do you encourage newer clinicians to be able to differentiate some of those things? In my experience, it took spending a lot of time around a lot of different neurodivergent folks before I could really start seeing the difference between some of the OCD presentations and some of the other kinds of neurodivergent presentations of things. So rather than, just needing lots and lots of clients to make mistakes on, are there other pathways and avenues that you would recommend that people look into to get more experience or more knowledge about this?
I have some like YouTube videos online where people can, get more information on it. The immediate response that came to my mind when you said that, like, how can they differentially diagnose, is that like, that's what the diagnosticians are for. So you can like kind of not stay in your lane, but ease up on yourself a bit. You don't have to know everything. That's why we have testing psychologists and neuropsychologists. But if it helps for the individual therapist just for their self-knowledge, or they're wanting to gain that expertise, just kind of diving into the DSM, and then also following individuals who do have that expertise, whether it be on social media, YouTube, like I said, and then learning from them, just soaking in whatever they can.
I think for me, the thing that I struggled with the most was kind of trying to differentiate autism or ADHD from trauma. And I think that can be huge, obviously. And with some of the clients, I did send them to get formal testing and mixed results on the things that came back as far as quality of testing and kind of how that all worked out. So that's a whole other conversation.
Right.
But I think if a clinician is sitting with a client and is trying to determine what does this presentation mean? How do I get started while they're getting this, kind of formalized testing? What are some ways do you think that folks can try to differentiate between a trauma response and a neurodivergent presentation?
Yeah. I would want them to keep in mind that a lot, and I don't know what the statistic is, if it's 80% or 90% of neurodivergent folks have had trauma experiences, because just how we show up in the world, especially as children, makes us more vulnerable to traumas, especially with individuals who take advantage of us because we're more, trusting and open and thinking that the honesty that we put forth is what everyone does, more naive about the world, if you will. And so, if a person is specifically looking to like, is this only trauma? Or is this trauma plus ADHD or autism? There are some very specific characteristics that are a part of autism, that are a part of ADHD, that aren't necessarily always present in trauma. It's usually both. And yeah, as I'm thinking about it, I haven't come across a person who had trauma who like suspected that they were neurodivergent, who was not actually neurodivergent.
That's interesting. That's interesting because I think that there's a self-knowing, I think, too, that clients can bring in as far as, oh, I'm starting to see like I'm not responding to things the same way, or now that I'm starting to hear these things, I recognize that I was bullied or I was taken advantage of, or I have these things that kind of are in my experience that I didn't recognize at the time. But I think it can be kind of a big deal to figure out, especially later in life, like, oh, some of that might have been some neurodivergence in there. And so to me, I feel like this is such an important conversation, kind of getting to the diagnosis. But I feel like because there's so many folks either self-diagnosing or getting formal diagnoses later in life, I think it may make sense to shift into like when a client walks in with a diagnosis, what therapists can do. If we're looking at kind of the tools that therapists can use for folks who have some flavor of neurodivergence, what are some of the things that you recommend that therapists have in their tool bag? Because I feel like, especially, nowadays, that people can go to TikTok and get all these tools, but like you don't know if they're like, oh, this worked for one person, or if this is more kind of has an evidence base behind it.
Yeah, I would say first, going back to like person-centered therapy is affirm and validate, and then affirm and validate. Because especially for late diagnosed individuals, so much of their life, they've been invalidated and told that there was something wrong with them, or made to feel othered and outcast. And so if they can finally in this therapy space be validated and say like, no, your experiences make so much sense. You are not alone. You're not weird. You're not, unless you self-identify that way, you're not, you're not an alien. You're no longer on this island. Let's build a bridge and help you find some connections where that, your spiciness is accepted and it's actually what makes the world go round. That's kind of like my first and second recommendation. The next thing is to get into the body, because a lot of therapists will provide mindfulness training or meditation skills, but that's really difficult to do if your default mode network in your brain is like constantly on chatter. And you're like, wait, what? Clear my mind? That's never happened. Not even when I'm sleeping. I have really vivid dreams. And so if you can get into the body and say like, okay, let's pair this breathing with EFT tapping, or with bilateral tapping, which is, really simple and requires very little explanation. Let's go for a walk. Let's just tap our feet while we're sitting here together, one and then the other. If you can get into the body using some of that more somatic work, then it's going to make the other stress management relaxation skills a lot more easy to do for that neurodivergent person. The other thing that I would recommend is helping them with executive functioning skills, because executive dysfunction is pretty prominent in both ADHD and autism. Most people think of ADHD executive dysfunction like, okay, poor time organizing and time management, having a hard time getting started with things, but it's also present in autism, even if it looks different. And so maybe the autistic person looks organized as far as how they present their materials on the outside, but internally they're having a very difficult time with prioritizing tasks, or transitioning from one thing to another important thing. And so if you can support them in evidence-based practices behind executive functioning training, that could be really helpful. So that includes the Pomodoro technique, which applies the pre-MEC principle. And it's a lot of, words and names. So basically it's like how to get things done. So it's a 6-step process. 1, decide on the task that needs to be done. And that's kind of a big one, because it's like, there's a lot that I need to do, right? Just choose one thing. Okay. And be proud of that. And then set a timer. It's called the Pomodoro timer, typically for about 25 minutes. Work on that task and then end the work when the timer rings and take a short break. And the pre-MAC principle, it's like you're pairing an undesired behavior with the desired behavior. So the undesired is whatever that task was, whether it be like opening your mail, which is something that I really struggle with, or going through your emails, which someone else might, have an issue with, or completing an assignment or whatever the case might be. But pairing it with something that you do enjoy. And so, okay, for 5 to 10 minutes, I'm going to have a dance break, or I'm going to, play with my fuzzy toy, or whatever the case might be. And then after that 10 minutes, go back to step 2, setting the timer and doing that task, and repeat this until you complete 4 Pomodoros, 4 of these cycles. And then after that's done, step number 6, take a long break, typically 20 to 30 minutes instead of a short break. And so that is, one evidence-based practice for being able to get things done. As far as the problems with initiation, which a lot of people have, like problems just starting, there's the law of motion by Newton. The things that, are in motion will stay in motion unless, acted on by an outside force and things.
Yeah, inertia.
Yeah, inertia. Yes, thank you. And so just doing one small thing can actually jumpstart your motivation to continue other things. And so, for example, yesterday, I was really into reading my book. I had the day off. I was really into reading my book, but I knew that I had so many other things to do. I needed to wash the dishes and put the, clothes in the dryer and, other things, around the house that like I personally despise and hate. And so I got up and I knew I needed to feed myself. So I said, okay, I'm just going to turn on the water, the hot water for the dishes while I'm, getting some food or whatever. And lo and behold, like literally, I did not intend this. After I turned on the water, since I was already at the sink, I was just like, well, let me just go ahead and put some soap in the water and just make the water. Let me just go ahead and start a little bit of dishes. But it got my momentum going and I was able to do other things. I also took a break and read my book some more. And then I set a timer my timer was actually for 2 hours. So like 2 hours after reading more of my book, then I'm going to go back and do something else. And so, notice how I found what works for me. If I were to do it in 30-minute increments, I would have been really depressed about that because I was like really into this new series and that it was my preferred activity, my interest. But because I made it work for me, I was able to get a lot done yesterday. And so with anything that you're recommending to your clients, usually what I recommend is, look, I'm going to give you, this strategy, this suggestion. You could do 1 of 3 things. You can do it right away. So take it and run with it. You can throw it in the trash. Like, no, that's not going to work for me. And sometimes we do have clients that are just like that, like, yes, but for everything. But so giving them that option, or you can put it in your pocket for later. And so maybe this isn't something that you want to do right now, but kind of just store it in memory, put it in your toolbox so that when the time comes, you can, engage in, this tool.
When you hire Buying Time, you get an entire team of accountable, knowledgeable virtual assistants with different specialties. It's a pretty amazing one-stop shop for your business needs. And I should know, I've been a happy customer of Buying Time since 2015. Buying Time has helped me and other therapists with admin and client customer service, finances and bookkeeping, including sending out invoices and super bills, setting up automated systems to take care of clients during onboarding, marketing, websites, social media, blogs, newsletters, and a whole lot more.
Buying Time believes in streamlining efficiency and being cost effective, so they help you to regularly evaluate systems to make sure you're not paying for programs and platforms you don't need. And They put together a free systems inventory checklist to help all of us to uncover hidden expenses and optimize spending in your practice. Go to buyingtimellc.com/MTSG to get your free checklist now. You're talking about a lot of skills for people to implement, and especially for those diagnosed later in life that have things like jobs that require them to be on somebody else's schedule. How do workplace accommodations work with some of these kinds of things?
Yes. Okay. So that's one of the reasons to get a formal diagnosis.
Is then you are covered by the ADA if you're in America, the Americans with Disabilities Act, because both autism spectrum disorder and ADHD are disabilities. So workplace accommodations, typically a person would go to their HR. So their direct management would not need to know specifically what their diagnosis is, but the HR would get that letter for accommodations and they would have to implement it. And all the direct managers would know is that this person has a disability that's covered and they meet these things. The typical things that are suggested are, being able to use headphones at work, having a sensory like low stimulating sensory environment or a separate office or cubicle, having additional time for training, being able to record any trainings, having any directions that are provided to you, both orally and written, being made aware of any major changes well in advance so that you can, adjust and accommodate your expectations for that. Having flex work, so a hybrid work schedule, work from home plus work from the office at times. Those sorts of things are all that can be included in accommodations that are for work. Now, depending on the workplace, depending on the size of the company, there are different, regulations around ADA. They don't necessarily have to accommodate all of them, but just getting that process started gets you a long way of protecting your job and also making your job more doable to accommodate your different needs.
It seems like there's, with the neurodiversity affirming movement, those types of things, a push toward accommodations and kind of living out loud, right? Unmask, be who you are, own your challenges. And I think there's also not a competing, but a parallel move around learn the skills, get yourself, not as close to neurotypical as possible. But I think, that some folks would argue that to be in, whether it's a workplace or other parts of the society, that neurodivergent folks need to show up and do the things, and you can't accommodate everything, those kinds of things. And so to me, I feel like there's a hard balance there. And I know that I recognize the answer is going to be, it depends, but I'm curious about your thoughts around how to balance accommodations and neurodiversity affirming acceptance, openness, those types of things versus skills training and really trying to help folks be successful within a typically neurotypical environment.
So when I think about skills training, I don't think about things that help the person be more neurotypical, but skills that help them become more self-accepting and to accommodate themselves within those environments. And so when I mention like wearing headphones, that's one of the things that can accommodate a person, whether they're in school or at work, even if people are just like, well, why are you doing that? Like you just listen to music all day, or, you're not paying attention, those sorts of things. Finding out what is it that you need to thrive in this environment and doing those things. That may be stimming. And stimming is not a typical behavior, especially in the workplace, but I'm going to do, this is a skill that I learned from my therapist, or that I learned on my own that I'm going to do, even if you don't like it. I'm going to have my, fidget toy, or even they have like fidget rings, with different things, that I'm going to have these things to help me to put up with being in this environment that was not set up for me. doodling during meetings for an ADHD person because it actually helps you to focus better. Those sorts of things. So that's what I think about when I think about skills building. I'm not thinking about, okay, how do you make yourself blend in more? Because a late diagnosed person already has years, sometimes decades of those skills. No, we're going to, as therapists, empower them and teach them the skills to help them to accommodate themselves. And that's more aligned with self-acceptance. What do you need? An example is, and this skills building is not just for the workplace, but also for the household. So for me, I need additional time and preparation if there's going to be a change in my routine. So I learned this the hard way when my husband had asked me to take our daughter to school. He takes our daughter to school every day. It's on his way to work. And I already had a meeting that day, but the meeting wasn't until 11. And he asked me this at 7 a.m. And even though there was like this 4-hour gap, it was such a hard transition for me to kind of rearrange the planning in my mind to accommodate this change. And so I made it work, dropped off my daughter, got to my meeting a few minutes late, and the person was completely understanding. It was a lunch meeting, so it wasn't like that big of a deal. But like I was near tears because it was so stressful for me to have this unexpected change to my routine. And so in our household, he knows if you need me to drop her off or pick her up, I need to know at least a day in advance. And this is very common actually for ADHDers and for autistic folks, that knowing in advance any changes to a routine is one way that they can advocate for themselves and make people accommodate themselves of how our brains work differently.
So we've talked about kind of later diagnosis, that folks are figuring this out based on TikTok or social media or whatever those things are.
Mhm.
And I'll give the answer and then go to the next question, because I think that some of the pieces are, folks who are assigned female at birth, just they're missed. They just present
Yes.
differently, those kinds of things.
Yes.
And so part of that, it seems to be, is successful masking.
Mhm.
And there's a lot that's out there around kind of unmasking and showing up. And so this is kind of going back into the neurodiversity affirming kind of piece.
Mhm.
What does it even mean to unmask? Like I've pondered this for myself. I'm trying to sort out what it means. And I think that there's so many different things, and maybe this is too big for a quick answer as we're running out of time. But I think that there's something around unmasking that I'd like to learn about, because I feel like it's such a confusing concept, especially for someone who I'm assuming has masked my whole life. So
yeah. And so that's the gift of diagnosis, whether it be a formal diagnosis or self-identification. Most individuals, when they get that late diagnosis, they start to unmask. And people are just like, all of a sudden you have all these autistic behaviors. Just like, no, like I'm starting to unpack and peel away the many, many layers of shame and fitting in, shame for who I am and how I am, and having to fit in so that I am accepted. And now I know that there's nothing wrong with me. My brain was built differently. It's wired differently. And I can love those things about me, but it's a hard process. There's like this relief that comes with the identification and diagnosis. And then there's this grief that comes. And so helping to peel back those layers of grief and shame, that's what the unmasking process is about. Like the way that it looks to others is, wow, you are really out there now. Or with my husband, like, you didn't have problems with changes before. It was just like, because I would stuff down all those feelings,
Yeah.
all the discomfort and near tears and things like that. There's no more stuffing down.
Yeah.
There's this openness that just feels like a breeze through your body. Whereas before, maybe were these dark, cottony, dark gray rain clouds with silent thunder inside you that just could not escape. All of a sudden, there's just the open breeze.
Okay, I thought that was my last question, but I have one more because I think it's related. And so like all the stuffing down, all of the masking leads to autistic burnout or neurodivergent burnout. And so any thoughts you have on navigating that?
Yeah, I will actually go to another expert in our field, Dr. Julie Lawrence with neuropsychology. In 2023, he had published the 5 S's for autistic burnout, preventing autistic burnout. And I think this would apply for our ADHD folks as well. So neurodivergent individuals have to prioritize healing, have to take breaks. And those breaks could be through respite, so like getting away from everyone, or through receiving support from family and friends. And so he created the 5 principles of healing from burnout. Stop. First S is stop or slow down as much as possible. 2, seclude or reduce contact with people, especially people who deplete your energy or resources. And those people could be family members. And so I'd love to talk, next before we end about family members, right? 3, the third S is special. Engage in your special interest for regulation and calming. I recommend doing that on a daily basis, doing it at work, doing it during breaks, all the time, and finding other people who also like your special interest. And so it could be joining a book club or a gaming club online, if that's your thing, because normally individuals assigned female at birth have special interests that are more like societally accepted, like, celebrities or video games or, those sorts of, pop culture. The third S is special interest. The fourth is stemming. Stemming is getting regulation through motor movement. And so that's where the therapists come in, where you're teaching these skills of, okay, let's do a walk, because walking is a bilateral movement, moving one side of your body, then the other. And that helps to engage the 3 main parts of your brain so that they're all talking with each other and you can help problem solve and also calm down. And then the last one is get support. S. And I would add in find your people. Find people that you can fully unmask around, where if you're ADHD, especially, you may be going from topic to topic to topic to topic, and they're just like, they're there with you. And then when you're like, what was I talking about? They're like, girl, I don't know, and then just keep going, and there's no shaming that another person is doing, against you. And I would add another S, smile. So there is research that was done, I think it's almost been a decade ago. It was with medical students, and medical students like super stressed out, right? And they took their blood to test cortisol levels before and after, having them to just smile or put a pen horizontally in their mouth. And just hold it there for like 30 seconds, because doing so stimulates the same muscles as a smile. So it kind of tricks your brain to think that you're smiling. And when they did that, there were actually lower levels of serum cortisol in their blood. And so that means that their body actually calmed down. There was less stress evident within their body with just a smile. And so find people and places that support you smiling so it's actually authentic. And then when it can't be authentic because, like family, what I'm saying, put a pen in your mouth horizontally.
Was there more that you wanted to say about families?
What is effective in communicating to family members about the later diagnosis? This is such a hard thing, and this is what you can get support from your therapist for, because
a lot of individuals have been gaslit by their family members and say like, oh, that's nothing, or, it's religiously covered up, like, oh, don't claim that, don't claim that on you, and those sorts of things. So that can be a very invalidating environment, especially when the individual recognizes like, I probably got it from you. Like, I've been watching you all my life. And so that's where this self-acceptance comes in. So I accept myself and I love myself and I see myself, and I'm not going to let you project your fears on me. Your fears of being fully seen as you are in your diagnosis, or your fears of what autism or ADHD means because you have only seen the stereotypes in the media. I reject that, and I fully accept and see myself. And I'm going to be in those spaces where I can just breathe.
Where can people find out more about you and the work that you do?
Yes, I have a couple different websites. One is drblied.com, spelled like my name, drblied.com. And the second is facesofhealth.net. And so for facesofhealth.net, that's where you can learn about my app, which is a great resource for therapists who are trying to learn about and teach somatic exercises and self-brain spotting and grounding skills. They're 2 to 3 minute videos that are freely accessible to everyone. And lastly, learn.facesofhealth.net is new, and that's where individuals can learn more about late diagnosis of ADHD and autism and how to support the individuals, including themselves, if they have that. I have a 5-module online course.
Nice.
And we will include links to all of Dr. Blied's sites in our show notes over at mtsgpodcast.com. Follow us on our social media, join our Facebook group, the Modern Therapist Group, to keep the conversation going. And until next time, I'm Curt with Katie Vernoy and Dr. Monica Blied.
A big thanks again to our partner, Therapy Notes, helping clinicians everywhere care more and worry less. Check them out at therapynotes.com. And don't forget that using promo code MODERN gets you 2 free months.
Buying Time is a full-service virtual support agency that is standing by to support you in your practice. It's time for you to get out of the day-to-day and bring in someone you can trust that has the experience to help you with all your business needs.
And don't forget to go to buyingtimellc.com/MTSG for your free systems inventory checklist. Get on the path to less expenses and more profit.
Thank you for listening to the Modern Therapist Survival Guide. Learn more about who we are and what we do at mtsgpodcast.com. You can also join us on Facebook and Twitter. And please don't forget to subscribe so you don't miss any of our episodes.